Here are 5 signs you must know before you go for your MRI, especially if you're trying to determine between lumbar stenosis and a herniated disc. So is it back pain or leg pain stopping you in your tracks? Whether it's sciatica shooting down the leg or an ache that makes walking a chore, you're probably wondering, do I have lumbar stenosis or do I have a herniated disc? And is surgery the only way out? After 30 years helping thousands of people ditch their pain and avoiding the operating table, I can tell you, you don't have to wait for your MRI to start feeling better. In this video, I'll show you 5 simple signs that will help you figure out exactly what's causing your pain, stop making it worse, and take control back. Whether it's pinpointing the difference between stenosis and disc herniation, managing your pain at home, or knowing what to expect from an MRI, I'll guide you step by step to relief. Let's dive in. Hi, I'm Dr. Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and without surgery. I upload a new video every week. In addition to that, I've created a free health vault. It's a collection of exclusive videos that gets delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. Now, here are the 5 critical insights we'll cover to help you understand your pain, identify whether it's lumbar stenosis or a herniated disc, and know what to do before your MRI. So let's start with number 1, how to identify your condition without an MRI. First, please understand this video is not a substitute for professional health advice. Always consult your primary doctor for a complete diagnostic workup and personalized care. Please choose someone who understands these conditions well. My goal here is to fill the gaps in as far as information goes that you may not be getting elsewhere, to bring some clarity to conditions like spinal stenosis and herniated discs, to offer you reassurance and hope, and hopefully guide you in the right direction. Having said that, there are 2 key ways to distinguish lumbar stenosis, specifically what we call central canal stenosis, and herniated discs. The first is by understanding their specific symptoms and clinical presentation, and the second is by recognizing practical signs that you can observe in your day-to-day life. So lumbar stenosis, specifically central canal stenosis, typically presents with dull, aching pain or discomfort in the lower back. This pain often extends into the buttocks and the legs, but is generally less sharp than the pain you're going to get from a herniated disc. Activities such as standing or walking for long periods can frequently worsen the symptoms. This is a phenomenon known as neurogenic claudication, so there's pressure on the nerve. Relief is commonly found by sitting, bending forward, or leaning on objects like a shopping cart. That's one of the key ways you'll know if you're someone, it's what we call the shopping cart sign, if you're someone who likes to lean forward on the shopping cart whenever you're going grocery shopping. Nerve-related symptoms in lumbar stenosis often include tingling, numbness, or weakness in both legs, usually symmetrical, so on both sides, due to compression of multiple nerve roots. This condition usually progresses gradually over time. It's often associated with age-related spinal changes like arthritis, degenerative disc disease. In contrast, a herniated disc is going to tend to cause sharp shooting pain that radiates down the leg, often described as electric or burning. That's a hallmark of sciatica. The pain may originate in the lower back, but is typically more severe in the leg. Certain activities such as coughing, sneezing, bending forward are all going to make the pain worse due to increased pressure on the disc. Prolonged sitting is another common trigger as it puts additional strain on the affected area. Unlike lumbar stenosis, nerve symptoms in herniated discs are often localized to one leg and include tingling, numbness, weakness resulting from that compression of the single nerve root. So remember, in spinal stenosis and that central canal stenosis, you're getting a narrowing that's affecting the entire spinal cord. When you're talking herniation, it typically affects one nerve root. So the onset of herniated disc symptoms is typically sudden, often triggered by lifting a heavy object or a sudden twisting motion or even a sneeze. By understanding these contrasting symptom patterns and triggers, individuals can better distinguish between the 2 conditions and identify which might be affecting them. Can you relate to any of the symptoms so far? Have you noticed if your pain feels better when sitting or worse when bending forward? Let me know in the comments. I'd love to hear your experience. So critical insight number 2, what causes the pain? So this is the anatomy of lumbar stenosis versus a herniated disc. Understanding what causes the pain in lumbar stenosis and herniated discs requires a closer look at spinal anatomy and how each condition affects the nerves. So in lumbar stenosis occurs when the spinal canal, that's the central passageway that houses the spinal cord and the nerve roots becomes narrow. That's what stenosis means. It just means narrowing. It's the exact same thing as if we're talking about heart disease and those vessels start to narrow. This narrowing is often caused by age-related changes, so that can be thickened ligaments, that can be bone spurs that come with degenerative disc disease itself, obviously. So as far as the anatomy is concerned, the spinal canal shrinks. It compresses what we call the cauda equina. So the cauda equina are the bundle of nerve roots that run through the lower part of the lumbar region. So the spinal cord eventually, as it gets closer to the lower part of the spine, actually turns into what we call the cauda equina. I think a cauda equina translated means horse's tail. The facet joints and what we call the ligamentum flavum, those are structures that stabilize the spine. They may enlarge and contribute to the narrowing as well. Now, obviously, this is going to impact the nerves. The narrowing creates pressure on multiple nerve roots simultaneously, leading to a condition called neurogenic claudication. So this pressure reduces blood flow to the nerves. It causes dull, aching pain, tingling, weakness, especially in the lower back, the buttocks, and both legs. The symptoms are typically symmetrical because the entire central canal is affected, not just one side. So that's why it's going to hurt, because when you're standing or walking, you're compressing the spinal canal even further. You're going to make that nerve compression worse. Bending forward or sitting opens up the canal slightly, relieving the pressure and reducing symptoms. That's why you get back to the person leaning on the shopping cart when they go grocery shopping. For a herniated disc, this is going to be different. The herniated disc occurs when what we call the nucleus pulposus, so that's the jelly-like center of the disc, protrudes through the outer fibrous layer. So this protrusion can press on nearby nerve roots, triggering pain and neurological symptoms. So as far as the anatomy goes, those intervertebral discs, they act as cushions between the vertebrae. The biggest thing they really do is they allow space for that nerve to come out of that opening. A herniated disc usually affects the discs in the lower lumbar spine, such as an L4, L5, or an L5S1. The nerve root exiting the spinal canal near that herniated disc is most commonly compressed. Now, that's obviously, again, going to impact the nerves. The herniation presses directly on a single nerve root, often causing sharp, radiating pain down the leg, known as sciatica. The compression irritates and inflames the nerve. It disrupts normal nerve signaling. It can lead to weakness, numbness, and tingling in the affected leg. Now, obviously that's going to hurt because activities like bending forward, sitting, or coughing actually increases pressure on the herniated disc, worsening compression of the nerve. So this is unlike lumbar stenosis, where the opposite thing is happening. Think of a herniated disc like a jelly donut. How I squish the front of the jelly donut, the jelly is going to squish out the back. The exact same thing's happening with a herniated disc. This is why the pain is often one-sided. Because that bulge or herniation tends to push out to one side, as only one nerve root is typically involved. So here are your key contrasts. In lumbar stenosis, it's going to impact the central canal and multiple nerve roots, causing symmetrical and gradual symptoms that worsen with standing or walking, versus a herniated disc is going to affect a specific nerve root, more often leading to sharp, localized pain and symptoms that are more intense during activities that compress that disc. Now, by understanding these differences in anatomy, you can begin to gain clarity about the source of their pain and why it behaves the way it does. Of course, things can get complicated where people can have both, and that's another reason why you need to see a health professional who is an expert in these matters. Now, does this explanation help you understand what might be causing your pain? Do you think the symptoms align more with lumbar stenosis or herniated disc? Share your thoughts or questions in the comments. I'd love to hear from you. Critical insight number 3, when do you need to worry about your symptoms? While some cases of lumbar stenosis and herniated discs can be managed conservatively, certain symptoms signal the need for urgent medical attention. Here's what you should watch out for and how to avoid your self-misdiagnosis. So lumbar stenosis, okay, let's talk about something important. When should you worry about your symptoms? While both lumbar stenosis and herniated discs can often be managed without surgery, there are certain red flags that mean you need to seek medical attention right away. Let's break it down, starting with lumbar stenosis. So for lumbar stenosis, here are the signs that you should not ignore. If you have severe or sudden weakness in both legs, especially if you can't stand or walk at all, if you have loss of bladder or bowel control, and this can signal what we call cauda equina syndrome, this is a medical emergency. You're heading straight to emerge, and most likely they're going to perform surgery right then and there. If you have persistent or worsening numbness in the groin area, which is another warning sign of cauda equina syndrome, that's what we call, basically like if you're sitting on a saddle, then that area in there, if you feel that. Now, it's important to avoid a misdiagnosis. Don't assume that age-related aches and pains are normal. If your symptoms significantly limit your daily activities or they progressively worsen, it's time to consult a health professional. Also, remember that stenosis usually affects both legs equally, unlike herniated discs, which we'll cover next. So when we get to herniated discs, let's shift to this now, where what you need to look out for is understanding a herniated disc. Now you're getting part of that disc actually bulging or herniating or protruding. So the symptoms and red flags can be quite different. It's important to know what to expect. So when do you need to worry? Well, for herniated discs, here are the warning signs to watch for. If you have sharp shooting pain that becomes unbearable, especially if it prevents you from walking or sleeping, if you have sudden severe weakness in one leg, especially if it's accompanied by what we call foot drop. So this is your inability to actually lift the front part of the foot. You may find you're tripping over things more often. Again, if you have bladder or bowel dysfunction, though rare with a herniated disc, it can occur in extreme cases of disc herniation causing nerve compression. Again, you want to avoid a misdiagnosis, so don't dismiss sciatica symptoms as just a muscle strain or a pulled muscle. Pain radiating down one leg is a key indicator of nerve involvement. Also pay attention to what triggers your pain. If it gets worse with coughing or sneezing or bending forward, that's a strong clue that it could be a herniated disc. Have you noticed any symptoms that seem more severe or unusual? Do your experiences align with what we've discussed so far? Drop a comment below. I'd love to hear your thoughts. Critical insight number 4, how do we manage the pain in the meantime? So this is very important. Some people, if you're in Canada, you're waiting 6 months for an MRI unless you're willing to pay for it. In the US, you're definitely paying for it. But there are people who wait to try and wait for that diagnosis. And while you're waiting, most of these conditions just progress. So now that we've covered, when to worry about your symptoms, when not to, let's talk about what you can do to manage your pain in the meantime. Many people want to avoid surgery. The good news is that there are effective non-surgical approaches that you can try. Let's start with lumbar stenosis. So for non-surgical approaches to lumbar stenosis, we want to focus on flexion-based movements. So those are movements when you're bending forward, where the trunk of your body is coming closer to the legs. This is key because it opens up that spinal canal and it relieves pressure in the area. So one of the best exercises you can do is what we call a knee to chest stretch. It's a simple yet powerful stretch. It helps alleviate pain by gently flexing your spine and reducing nerve compression. So very simple. This is how you do it. You simply lie on your back. You pull one knee to your chest. You pull it towards your chest, you hold it for a good 20, 30 seconds, but you don't even have to count. Hold it long enough until you actually feel some relief. Then you're going to repeat with the other leg, okay? And then you repeat that again. You can try pulling both knees at the same time. In addition to exercises, there are non-surgical approaches like chiropractic adjustments, spinal decompression therapy, nutritional supplements can support healing, reduce pain naturally, bring down the inflammation. Now, let's look at how you can approach herniated discs differently. So for a herniated disc, the focus is going to shift to the opposite movement, what we call extension-based exercises. That's going to reduce pressure on the disc and help move it away from the affected nerve root. So a great exercise for this is what we call a prone lumbar extension. So prone means that you're lying face down on a flat surface. You're going to gently prop yourself up with your elbows. You're going to arch your back slightly. And then again, you're going to hold this for a good 10, 15, 20 seconds, but enough that it feels comfortable. It should never be painful. And so that you can actually feel it ease up, you're going to gradually work up to 30 seconds as it becomes to feel more comfortable. Like lumbar stenosis, herniated disc pain can also benefit from non-surgical options such as chiropractic adjustments, spinal decompression, targeted therapy, lifestyle changes that reduce inflammation, promote recovery. You want to incorporate these approaches so that you can help regain mobility and manage pain while you're waiting for your MRI. We have a lot of people who we've fixed up before their MRI is even scheduled to happen. So don't simply wait for the MRI if there are things that you can do to help alleviate the pain and help to get to the underlying causes of the problem. As for the exercises mentioned, they're a great starting point, but remember that each condition responds differently. So it's important to listen to your body and avoid movements that make your symptoms worse. And again, that's why professional advice is so important. You may be suffering from both of these at the same time. You're going to need some help with figuring that out. Now, before we move on, I want to highlight a cornerstone of our 7-step neurospinal restoration program, including non-surgical robotic laser spinal decompression. This advanced treatment protocol combines true spinal decompression with class 4 deep tissue laser at the exact same time. It offers a powerful and effective solution. We have over a 90% success rate in treating conditions like lumbar stenosis and herniated discs. It's helped many patients find relief and regain their quality of life. There is nothing else like it. If you have pressure on the nerve, pressure on the disc, and the disc is rehydrated, you need to take the pressure off the nerve, the pressure off the disc, and you need to rehydrate that disc. If you're interested in learning more, check out the link in the description below to see how it works. Have you explored non-surgical treatments like spinal decompression or specific exercises for relief? Share your experience and questions in the comments. I'd love to hear your thoughts. Now, what will the MRI actually show? Now that we've discussed ways to manage your pain, let's talk about your next step, getting your MRI. For many people, this imaging is an important tool for getting a clear diagnosis, but even before your MRI, understanding your symptoms can provide valuable clues about your condition and prepare you for what results, what they're going to reveal. So what will the MRI actually show? An MRI, otherwise known as magnetic resonance imaging, it provides a detailed look at your spinal anatomy. It can confirm whether you're dealing with lumbar stenosis, a herniated disc, another condition entirely, or in fact both at the same time. For lumbar stenosis, an MRI will show if the spinal canal has narrowed and by how much. It also highlights whether age-related changes like thickened ligaments or bone spurs are compressing the nerves. This helps your doctor determine the severity of the stenosis and whether non-surgical treatments are likely to help or if surgical intervention is necessary. For herniated discs, an MRI can pinpoint the exact location of the herniated disc and how far it's pressing on the nerve root. It also reveals the size of the herniation, whether it's causing inflammation around the affected area. This detailed imaging ensures that any treatment plan, whether non-surgical or surgical, directly targets the root cause of the problem. Now, why is a pre-MRI understanding important? That's exactly what we've been talking about. Even before your MRI, understanding your symptoms can provide valuable insight. By recognizing specific patterns like flexion relief in stenosis or sharp leg pain in the herniated disc, you can help your doctor zero in on the right tests and treatment options. This knowledge can save time, reduce anxiety, and help you feel more in control of your health journey. Does this explanation help you feel more prepared for your MRI? What questions do you have about what an MRI can reveal or how it might guide through your treatment plan? Share your thoughts in the comments. I'd love to hear them. You now have one of the most thorough guides to helping you distinguish between lumbar stenosis and a lumbar disc herniation. I hope this information has given you some clarity and direction. Remember, this video is strictly informational and not a substitute for health advice. If you're experiencing any symptoms we've discussed, don't stop here. Consult your doctor to get the personalized care that you need. And if you're feeling overwhelmed, know that you're not alone. Many people have been where you are and they've found relief. There are effective treatments and solutions, and with the right guidance, there's real hope for improvement. Take it one step at a time. You've got this. If you found value and clarity in figuring out the difference between lumbar stenosis and lumbar disc herniations, please like this video and share it with others who it might benefit. Your support helps spread helpful information to those who need it most. And don't forget to subscribe if you're looking for more proven tips and strategies to treat and relieve debilitating back and neck pain without relying on drugs or surgery. If you want to learn all about the revolutionary non-surgical robotic laser spinal decompression and how it's changing lives, go watch this video next.